There's a hidden truth that most seniors will never hear from their doctors. Every year, millions of us line up for health checkups, thinking we're staying safe. But what if I told you that some of those tests, the routine ones your doctor says you need, could actually be doing more harm than good? If you believe in questioning the status quo for better health, be sure to like this video and subscribe for more eye-opening content. New studies reveal that a huge percentage of medical tests in seniors can lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, most people over 70 have no idea they're being over-tested. You won't hear this from your clinic. You won't see it on a billboard, but the truth is buried in the science, and today, we're uncovering it all. In this video, the 5 health checkups you should reconsider after 70, and the real story about what they can do to your body, all backed by science. And you won't believe what made it to number 2. Before we begin, let us know in the comments below where you're watching from, your age, and have you ever regretted a test or procedure? Your perspective is so important. We're reading and replying to every single comment. Now, without any further ado, let's talk about the first one, why it looks smart, but could quietly ruin your quality of life. Number 5. Aggressive blood sugar control in diabetes. Our final point isn't a single test, but a whole philosophy around testing and treatment, the aggressive management of blood sugar in older adults with type 2 diabetes. For a younger person with diabetes, keeping their ONIC, which is just a measure of your average blood sugar, as low as possible, is critical. But in an older adult, this aggressive approach can be incredibly dangerous. Here's the problem. The primary risk is hypoglycemia, or dangerously low blood sugar. Pushing blood sugar down with medications can easily go too far, leading to an episode that causes dizziness, confusion, falls, fractures, and even seizures. For an older person, a serious fall can be a life-altering event that leads to hospitalization and a loss of independence. The risk of one severe hypoglycemic event often outweighs years of potential benefit from tight glucose control. Let me tell you about Frank, an 80-year-old diabetic whose doctor was pushing him to get his ONIC below 7%. One afternoon, his blood sugar dropped too low. He became disoriented, fell in his kitchen, and fractured his hip. The surgery and rehabilitation cost him his ability to live independently. His life was forever changed, not by high blood sugar, but by blood sugar that was driven too low. Recognizing this, groups like the American Diabetes Association have changed their guidelines. For many older adults, a reasonable ONIC goal might be under 7.5% or even 8.5%, depending on their health. The focus shifts from hitting a number to a more important goal: avoiding hypoglycemia. The smarter alternative is to reevaluate your goals with your doctor. The question should change from, how low can we get this number, to, what is the safest and most stable range for me right now? Number 4. The Pap smear for cervical cancer. This next one is perhaps the most clear-cut of all, the Pap smear. The Pap smear has been one of the greatest public health triumphs of the 20th century. But its job is largely done by the time a woman reaches 65. Virtually all major medical organizations agree that women can stop screening for cervical cancer after age 65, as long as they have a history of normal tests. If you've had at least 3 consecutive negative Pap tests or 2 negative HPV tests in the last 10 years, it's time to graduate from this screening. The reasoning is simple. Cervical cancer is caused by the HPV virus and develops very slowly, over decades. If a woman has had regular negative tests up to age 65, her risk of developing a new aggressive cervical cancer is infinitesimally small. Continuing to do Pap smears in this group gives almost no benefit, but it can lead to false positives and unnecessary, anxiety-provoking follow-up procedures. This is less of a risk-benefit calculation and more of a mission-accomplished scenario. The smarter alternative here is simply to follow the well-established guidelines and stop the test. If you're over 65 and still getting routine Pap smears, ask your doctor why. It's very likely an unnecessary checkup. Number 3. The routine screening mammogram. Brace yourself, because the next test on this list is one you've probably had multiple times. Just like colonoscopies, mammograms have been a cornerstone of preventive health for decades. But again, as a woman enters her mid-70s and beyond, the picture becomes much less clear. The USS Preventive Services Task Force states that after age 74, there isn't enough evidence to know if the benefits of screening outweigh the harms. Here's what no one tells you. The primary concern is overdiagnosis. This is when a scan finds a slow-growing breast cancer, often a type called DCIS, that would never have caused symptoms or become life-threatening. For every life saved by screening mammography in older women, it's estimated that several more are overdiagnosed. This diagnosis, while technically cancer, leads to a torrent of fear and aggressive treatments, biopsies, surgery, radiation that were never needed. Take Eileen, a vibrant 79-year-old. A routine mammogram found a tiny area of concern. The follow-up biopsy confirmed a low-grade DCIS. Even though her doctor explained it might never progress, the fear of cancer was overwhelming. She endured a lumpectomy and weeks of radiation, leaving her fatigued and with chronic pain. She was treated, but was she made healthier? Or did the screening process itself diminish her quality of life? The smarter alternative is shared decision-making. It becomes a conversation where a woman and her doctor discuss her overall health, life expectancy, and personal values. For many women over 75, the answer may be to stop routine screening and focus on quality of life. Number 2. The routine screening colonoscopy. You probably didn't expect this one. But a colonoscopy, which uses a long camera to examine your colon, is not always a wise choice after age 75 unless there are specific symptoms. First, the risks go up with age. The preparation is notoriously harsh and can cause severe dehydration and electrolyte imbalances, sometimes requiring hospitalization. The sedation carries higher risks for the heart and lungs. And perhaps most surprisingly, the test itself can cause complications like bleeding or a tear in the colon wall, which is a serious issue that is more common in older patients. A 2019 study in JAMA Internal Medicine found that for individuals aged 76 to 85, screening decisions should be made on an individual basis, and it's not recommended at all after 85 for most people. Finding and removing a small polyp in a 50-year-old might prevent cancer 15 years later. But for an 80-year-old, they are more likely to pass away from other causes long before that same slow-growing polyp becomes a problem. The benefit is theoretical, but the harm can be very real. This happened to Margaret, a 78-year-old woman in good health. Her doctor ordered a routine screening colonoscopy. The prep left her weak and dizzy. During the procedure, a small polyp was removed, but she developed a post-procedure bleed that landed her in the hospital for 2 days. She recovered, but the experience left her frail and shaken. For many seniors, a safer alternative is a non-invasive, stool-based test like the FIT test. It can be done at home with no prep and no sedation, and it's excellent at catching warning signs. Ask your doctor about alternatives, because once you're in the colonoscopy pipeline, it's hard to get out. Number 1. The PSA test for prostate cancer. And now we've reached one of the most overused and debated checkups for older men. The prostate specific antigen, or PSA, blood test. For decades, men were encouraged to get this test annually to screen for prostate cancer. For a younger man, catching an aggressive prostate cancer early can be a lifesaver. But the landscape completely changes for men over 70. The U.S. Preventive Services Task Force explicitly recommends against routine PSA screening for men in this age group. Here's why. As men age, it's extremely common to develop very slow-growing prostate cancers that would likely never cause any problems. But the PSA test can't tell the difference between a harmless cancer and a dangerous one. A high PSA number often triggers a chain reaction of anxiety and invasive biopsies. If a low-grade cancer is found, it leads to a difficult choice: aggressive treatment like surgery or radiation, or watchful waiting. The treatments themselves carry substantial risks that can permanently damage a man's quality of life, including incontinence and erectile dysfunction. For a slow-growing cancer that was never going to be a threat, this is a terrible price to pay. Let me tell you about Robert, a 73-year-old who was active and loved golf. A routine PSA test came back slightly elevated. This led to a biopsy which found a low-grade cancer. Terrified by the C word, he opted for surgery. While it was technically successful, he was left with persistent incontinence that made him hesitant to leave the house. He traded a theoretical risk for a very real, daily struggle that destroyed his quality of life. The smarter alternative? Instead of automatic screening, the focus should be on an individualized discussion with your doctor about your overall health and family history. For most men over 70, forgoing the routine PSA test is the recommended path to avoid overdiagnosis and the harmful cascade of overtreatment. So there you have it, 5 checkups that may seem helpful, but can actually hurt, especially once you're past 70. The message today isn't to stop seeing your doctor. It's about engaging with your health in a more intelligent and personalized way. Modern medicine is powerful, but it's not perfect. Sometimes, less is more. Always ask, what happens next if this test finds something? If the answer is unclear, or if the risks are higher than the reward, it may be time to pause. Real prevention starts with lifestyle. Stay active, eat well, and choose your checkups wisely. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share your experiences with us in the comments below. We love hearing your perspective. Thanks for watching. If this video was helpful, please give it a like and subscribe for more content that empowers you to take control of your health.